more in our sustainable development. So for this presentation, I will show a brief overview of my country profile, the health system performance, and the maternal health status. As you saw in the title, is about teen pregnancy. So we will discuss about the risk factors and the main issues for adolescent sexual and reproductive health, and also what are those initiatives and existing programs in Madagascar to face those risks and main issues. But we still have some challenges, and then at the end we will conclude. Madagascar is an island very close to South Africa. Those of you who know South Africa is our neighbor, and with Mozambique. It's only 600 kilometers between South Africa and Madagascar. So it's in Indian Ocean. And maybe you didn't know that Madagascar is the 4th largest island in the world. Just to give an idea how big is it, it's similar size of Arizona. And we have 20.7 million of population. And as I said at the beginning, that 44% of population are under 15. So you can imagine the shape of our pyramids. I don't need to show that, but it's just big on the basement. The birth rate is still high, 7.8 children per mother. So everywhere you go in Madagascar, you will see a big family, a lot of children around. But this is a low, if we compare to the rural area, but this is just a national, so including urban and rural birth rates. Diverse geography in the east, in the west, and it also about climate. So this part is in the east, it's humid and hot, a lot of raining, and in the west part it's very dry and hot. And the south is, as you see in the picture, it's very, very dry and hot. And in the middle, it's kind of strong temperature fluctuation. So the capital is, I'm sorry I don't have the control to point it, but in the capital is situated in the highland in the middle of Madagascar. So it's totally different everywhere. Just a quick overview that everywhere in the coast, our ancestors are from Africa, and I am typical from the coast. And in the highland, the ancestors are from Malaysia and Indonesia, so people look more Asian people. And the culture is different. We are from the coast, and we are very loud and open and more wild, savage a little bit. But people in the highland are more like quiet and respectful, like in Indonesia or Indonesia. This is the capital, Antananarivo, and this is typical house in my hometown along the coast, Indian Ocean, or along the coast in the Mozambique Channel. I want to start with this proverb that we still have it, and it's very famous, that after your wedding, you get a blessing to have 7 boys and 7 girls. It seems like, wow, how can we do that nowadays? Because that's kind of like a big family to have 14 kids. But this shows our value on having children, because children are considered as inheritance, the best gift from God, which is in contrast of the rate of abortion in the country too. But this relates to our annual population growth, 2.9. The GDP is very low, $400. Life expectancy is improving since 2007, which was 59, and now it's almost 67 years. Infant mortality is 44. If you compare that with the US, it's still very high. Literacy rate among females is 28, 24, 64, so we still have almost 36% who cannot read and cannot write. The prevalence of HIV is quite low, and if we compare Madagascar to some African countries, Madagascar has the lowest HIV prevalence in sub-Saharan Africa. I don't know if you can see, but this is a Okay, this is South Africa, and they have HIV prevalence 70.8% of HIV prevalence. And our neighbor Mozambique has 11.5. In Madagascar, we have 0.2. So if we compare that, Madagascar has the lowest. Even if you go to another country in Africa, we have the lowest. But there is a contradiction between our HIV prevalence and our STI prevalence. We have one of the highest STI and STDs prevalence. And some studies show that maybe you have lowest HIV prevalence because you are in an island and you don't have any connection with the other African country. And also another study show that because 100% of Malagasy male are circumcised. I always have this problem. I'm talking about circumcision. So all of them, 100%, because that's part of African culture, and so 100% is have the circumcision. So the studies show that that's one of the reasons we can maintain this low HIV prevalence. But they are still working on that. So if we continue to not invest to reduce this STI prevalence, this may very increase dramatically in 5 years. And back to my presentation, the economics are based on agriculture because 80% of Madagascar people are farmers, but it's not a business farm, it's subsistence farm. 2/3 of the population live below the poverty line, and they call it that 70% of Madagascar population cannot afford to buy, how can I say that, basket of food every day. That means it's under than $1 per family. So there is a lot of poverty in terms of economies. And our politics from our first republic, there is no stability. After our traditional monarchy, we were colonized by French, so French is our first official language. And then we get our independence in 1960. But along that date, until today, we have been facing socio-economic and political crisis. And 3 years ago, we have a coup d'etat, and now we have our youngest president in Africa. I put president because our government now is not recognized by international community because it's unconstitutional. So they are there, but trying to organize the election, and they could not because now they are debating on amnesty for our ex-president. Our ex-president is exiled in South Africa, and they don't allow him to go back to the country. So they're still debating on amnesty instead of organizing the election. So this instability affects all of the development indicators, all of the work that we've been doing from the former president. There is no continuity to the new government. Education, as I said about literacy, we still have more than 30% who cannot read and cannot write. And among female 15 to 19, the highest level of education, even in primary education, we couldn't achieve the 50% of those female 15 to 19. So that's one part of our priority today, to invest in education and keep the girls longer at school. We are one of the famous island in Africa for tourism because we have beautiful beaches and animals and forests, and you find everything you need there. But this tourism is related to sex tourism too, because of the socio-economic status and the poverty. So a lot of girls are victims of sex tourism. They get money, and especially in the coast, all of the coast in Madagascar, they get a lot of tourism. And tourism can be local tourism or international tourism. So all of them affect the adolescents, girls. And there is, the parents play a role too, to push their adolescent girls to go with those tourists to get money and bring money back and take care of their siblings. But this is not the major problem, because this is not all in Madagascar, but part of Madagascar. Health system performance, we have limited medical facilities. This is just a number, but when we take a look at the community, a lot of them don't have medical facilities. Some of them have 15 kilometers between the nearest health facility and the community, so they have to go like 2 days to reach the health center. The hospital equipment is 3 beds per 10,000 population. So you can imagine if I want to go to the hospital and I get there, there is nothing, no equipment to serve me. And even I go to the hospital, sometimes we have the equipment, but we don't have the personnel, skilled personnel to take care of it, especially in the rural area. Our physicians ratio is not very low, but most of them are working with non-profit organization because the government salary is very low, so all of them are working in public health and education and monitoring and innovation. And the last part is most of the job in public health is done by the community health workers. So we have 3 types of community health workers. The first type are those who are trained to do the basic education. So they visit household and they collect data, collect information, and do all of the communication. And the second type is those who are trained to sell, like for example, contraceptive, and to sell like basic medicine for headache or for diarrhea. So they got the training for that. And the second group of the community health workers are those who are trained to do, for example, injection. So they give vaccination and they do the injection in the village. Because we don't have enough medical doctor to do all of that job. And most of them want to stay in the urban area because they have their kids and they want their kids to get good education. So they don't want to stay in a rural with nothing for their kids. So we are using a lot of community health workers to do the job. Maternal health status, our objective for the NPG should be under 137 for the maternal mortality, but now we still are very high, almost 500 per 100,000 live births. So compared to the US has 12.7 maternal mortality ratio. So a lot of life, we lose a lot of life every year within this maternal mortality. And also maternal health care utilization is limited 50% and 40%. And the contraceptive pregnancy rate is very low because of the access, because of the service, and because of the perception. A lot of people are afraid about their fertility once they start to use contraceptive, and they are afraid to use the modern contraceptive. And that's not the unique reason, but a lot of parameters go together to block our rate very low. And then the under mortality rate is 61 per 1,000 live births. So if I compare the maternal mortality in Madagascar and the average in sub-Saharan Africa, so we have lower than the average of all of the countries in Africa, but it's still far from our Millennium Development Goals. The risk factors for adolescents sexual, as I said, Madagascar, we are still under cultural pressure. So those girls are under that culture too. So anyone talk about sex at home, that's weird to talk about menstruation at home. Even communication between mother and daughter, no talking. So most of the girls learn from their peers. Of course, then they get wrong information sometimes. By the taboo, it's sometimes they try to open the dialogue, but it's hard because they don't have enough. I think it's similar case in everywhere in this in in Madagascar is extreme because they don't talk anything. And but in urban it's different from the rural. So this is more in the rural. The family and community values about having a child. As I remember, the proverb is to have 7 boys and 7 girls. That's a blessing. That is for married couple. But if even you don't get married, they always welcome their grandchildren. And so the parents value and the community value this, push the kids. And if you remember the picture that I showed when I talked about our ancestor, the little girl bearing her sibling. So that's the case. Like, I have been taking care of my youngest sister since I was 7. So what's a big deal for me even I get pregnant when I am 14? I've been doing that for all my life, taking care of baby. That's my job, and I didn't go to school. So that's all of that picture. Keep the girls in the same situation again and again. And we still have this traditional transactional section. This is in the west part of Madagascar, very rural and a lot of insecurity. But this is a weekly market that the ranchers come for their transaction and they get money. So the parents send their adolescent girls to go to the market and spend the night with the ranchers. And there is no policy and no law about controlling the age of the girls who come to this market. And also we have this Jumena or red light. This is in the east, and this is part of a cultural event that a lot of girls participate and pushed by the parents too. And no control. Sex tourism, I've been talking about that because they get money and they are pushed by the parents. Relationship with married men to get money, that may be similar case in some countries. But we also have the lack of access of reproductive health and education and lack of information. So a lot of unintended pregnancy, unsafe abortion. Abortion in Madagascar is illegal. From French colonization, there is no exception for abortion. A long process. If the life of the mother depends on abortion, that's the only exception for abortion in the country. So a lot of people do it at home, using cassava, something with cassava, or wherever they find that they can provoke abortion. So it's usually, non-hygienic, so a lot of infection and complication, and we don't have a post-abortion care because it's still illegal. So they are afraid to go to the hospital if they have complication. So a lot of them stay at home. Some of them still go to the hospital, and the hospital take care of them. So they say like 52% of maternal deaths are caused by abortion, right after the abortion or complication after abortion. And the early childbearing is still low. Before 18 years old, we have almost 25% of the girls. Syphilis among 15 to 49 is 6.3. And this is the maternal mortality by age. This is a little small, but this is Madagascar. So comparing the adolescents' rates within the adult women. So we have a low rate on perinatal mortality by age of women. So related to all of that, problems and situation, we have some initiatives and program, national policy of youth. Actually, we have Ministry of Youth and Recreation, independent from the Ministry of Health and the Ministry of Education. And the ministry have been starting to build this club tandem with peer educators. So those peer educators are working with their peers to educate them and bring them to different activities to avoid risk behavior. And we have also the youth center and the information kiosk resolution. And this limited on the urban commune and district, not in the rural area. And this last one is one of the popular campaigns that we have been doing, the Card Madagascar Girls Decide Now. So they use this campaign to empower girls to make their own decision and protect themselves between girls and men, or between girls and their parents, when their parents push them to go to risk or to try to get money from married men. So this is their power, like I decide now, you will not decide. Another initiative was with UNICEF, with Genial Reporters Club. This is developing a radio program and spread all of the country, and peer educators for life skills program, youth SMS, Allo Fanantenana or Hello Hope is usually free phone call. UNFPI had last year a big campaign about teen pregnancy prevention, 7 million d'actions, and then we still have the peer education training. USAID with US Embassy just opened Because Liberty is a youth leader debate program. They talk about many topics, but reproductive health is included in this. And also we have the Civic Empowerment Center opened by business. And PSI had been starting this co-preso in 2000. This is a networking of clinics. So they create the demand from the community. Their team are working in the community and bring those people to go to the clinics. So the clinics are ready to give the service, and the team working to create the demand. And also they have the social marketing and STI treatment program, Protector Plus and Curacet. All of that are still initiative and program, and they are still working together, but it's still challenging to target the women in the hard-rich area, in the rural, and also facing the poverty to stop the sex tourism, and within the instability of the politics too, because our ex-president has this program before, but the new government didn't continue it. So now we're back to the sex tourism action. And also how to keep the girls in school longer. Our education system was 5 years in primary school, and then our ex-president extended to 7 years just to keep those girls at school. Because once they finish the primary school, they have to go 5 kilometers at least to go to a middle school. So all of the parents just say, yeah, that's enough for you. We will be taken care of by your husband. So most of parents promote the education for their son, but not for the others. Because wife should be taken care of by their husband. That's the belief in Madagascar country. And also the lack of staff and equipment and skilled health workers. So in sum, we are facing the political instability, and that affects our public health. We still have the high fertility rates, because just reminded that it was 5.8 children per mother, and limited resources for healthcare service, and the pressure on culture and socio-economic. But we are still working on those initiatives and campaign and program, working together with the Ministry of Health and Ministry of Youth, and the US Embassy, USAID, UNFPI, and UNICEF. But we still have some challenges to reach our aim to achieve our. And it, of course, to challenge to build the capacity of those young people to be the future workforce of Madagascar. Thank you so much for your time.